important question that everyone asks me. When can I fly? I mean, fly means take flight or journeys, right? When can I go back to my gym? When can I do my exercises? And when can I start my alcohol, right? Now, I would like to answer these three questions in three different points. Number one, when can you take your journeys? As far as road journeys are concerned, you could do it from the second and the third day. But would that mean a prolonged road journey? No. If you really have to take a prolonged road journey, you will have to break it into an hour, hour and a half journeys. For example, if you're traveling from this place, from Delhi to say Ludhiana, right? You could travel on the third day, but you need to break down your journey into an hour journey. So every 1 hour, get out of the car, take a round or two of the cars, go stroll for another 10, 20 steps, sit in the car, again take that journey. So you need to break down that journey. Train journey, similarly, you could sit for an hour, get up in the train, walk around, and then continue your journey. Similarly, if you're taking a flight, short flight like 1.5, 2 hours, please take it. If you're taking a long flight from international patients who come from, let's say, Nigeria, Nairobi, US, UK, all those places, on the third, fourth day, you could take the travel, you could take that flight. However, be sure that you take a low molecular weight heparin, keep sipping, keep wearing your stockings, which you are instructed to do, and again, break the journey. How do you break your journey? So till the time you actually get on board, keep moving at the airport. Once you're in the aircraft, every 40 minutes, every 1 hour, get up, take a small stroll, sit down again, get up after 40 minutes, take a stroll. If the DVT pumps are available in many flights, and if you're traveling by the business or the first class, you would also get a DVT pump. You could use them. It's a very good thing that is available on the flights now. And you could continue with your flight. So travel, yes, you could as early as 48 hours, as long as 10 to 12 hours journey, but break it into smaller things, smaller portions, as I said. Break your journey into smaller journeys, get up frequently, take a walk, continue your pressure stockings, continue your low molecular weight heparins, and listen to the surgeon and listen to what the instructions are given in the bariatric manual. So, second is how early can you start your exercises? Now, exercises, as I always say, all my patients, I instruct them to go back to your work as early as possible. Two things happen. Number one, get back to your normal surroundings. The moment you get back to your normal surroundings, you feel well. If you're sitting in the room, if you're sitting in the hospital, or if you're sitting at your, your desk, you always feel that, I've been operated and I'm not feeling well. But if you get back to your office early, if you get back to your work early, the surroundings will always help you to get better and feel better. So early mobilization, post-surgery, early return to work, because we do it laparoscopically, take advantage of the fact that we are doing it laparoscopically. Take advantage of the fact that the procedure that we do, the way we do, is a very short procedure. So early return to work, third day office work, light walking from second week onwards, brisk walking third week onwards, light training after a month, heavy weightlifting after about 2 months, when you've already adapted to the change of diet that you've done. As far as smoking is concerned, it's an absolute no. I would advise all my patients, all my friends undergoing the surgery, please stop smoking. If there is one thing that you should not do, and there's one habit that you've got to change, that is smoking. Smoking will increase the chances of stomal ulcerations, or ulcers which form at the place where we join the stomach and the intestine. So smoking is an absolute no. Alcohol, for the first 2 to 3 months, avoid alcohol. Post that, you could start alcohol, but in a smaller quantity. No fizzy drinks, no beers, no champagnes. Yes, probably whiskeys and vodkas are okay. Red wine is brilliant. So a very small quantity, a small peg, and you can even break down the peg into 15 to 20 ml with some amount of water. Sip it slowly. You must realize, after this surgery, the effect of alcohol will be more pronounced, much faster than what you're used to. So for example, if you're used to taking, let's say, 4 small pegs, right, over a period of, let's say, 1 hour, the effect that you get, the mood elevation or any effect, or the psychosocial effect that you get post-alcohol, would be similar in about 1 to 2 pegs in about half an hour. So divide your drink, do it very slowly, only after 3 months, only if you must. Otherwise, it's always good to avoid drinking, isn't it?